we're not as safe as we think we are.
I think we have to be braced for a huge mental health crisis.
On the second day of term at Cambridge, I developed symptoms of coronavirus. So I had a mild temperature and a cough, and I reported these symptoms and my whole household was put into isolation.
Isolation at Cambridge meant that we were put essentially in solitary confinement. We were pretty much confined to these four walls with very, very minimal contact from people on the outside. When you're treating your space like a bedroom and a kitchen and a desk to study on and a studio, that becomes very, very cramped very, very quickly.
When you make everything uncertain, it makes people feel very anxious. So anxiety has gone up significantly. The other very significant problem for young people and students in particular has been isolation and loneliness.
After the first term of Cambridge, it was 5 out of 8 weeks that we were in isolation.
Isolation really, really gets you and starts to affect your work and just your enjoyment of things.
We were alone in this institution where we hadn't had any time to make friends. So it was basically just being completely alone. There was no outside perspective to cheer us up or make us feel better because we were all in the same negative mental state.
Meeting new people is particularly important for those under the age of 25. It's actually a biological drive that they have to spend more time with their peers and less time with family. We know that, we recognise it in teenagers, but that doesn't stop at 18. It actually goes on till the mid-20s or late 20s. And whether that's to make friends, meet a life partner, learn from others, all of that is so important, and disrupting that process is actually bad for them. It's bad for their health, it's bad for their well-being, and it has a quite potentially long-term effect if it's a constant.
I experienced really physical symptoms of depression, which I've never really experienced before. So I would really struggle to wake up. I'm a clean person and my room was an absolute tip. Struggle to keep up with basic levels of self-care, so showering and eating proper meals.
We actually use isolating people as a punishment. It's been since the very earliest days of cavemen. If the person was banished out of the tribe and out of the cave, they didn't survive very long, because without other people around us, we don't do well for lots of reasons.
Even when we were out of isolation, we still had that really numbing feeling of just being alone for weeks on end that took us a while to recover from, just because of how traumatic it was.
I started to feel really tired during the day when we were trying to study, and I'd find it would take me sort of 3-4 hours to get through a 1-hour lecture, and I was just really exhausted. And then one night I remember I went to bed early, and then about 1 or 2 hours into my sleep I woke up in the middle of the night and went into the bathroom, and I just remember feeling really dizzy and experiencing really bad chest pain, which I found really alarming because I've never had chest pain before. So that really scared me, and I texted 2 of my friends in my household.
So we got Hannah a taxi to the hospital, and it's a terrifying thought to think that if me and my other flatmate hadn't been awake at that time, Hannah would have been suffering on her own.
They found that basically that my liver and kidneys were inflamed, and what they then concluded was that my organ inflammation was a result of having had coronavirus. I was in hospital for a week as a result of it.
Something seriously bad could have happened. We would have had to live with the guilty conscience of knowing that we could have done something, but we just happened to be asleep. And that is a terrifying thought that really, really affected me for a very, very long time after the incident. I think the trauma that students are facing within university is really being minimised.
They've probably, dreamt about this since they were younger, about, I'll go to university, or I'll travel to other countries, or I'll take a gap year. And those have, been crushed to a certain extent. And it's easy for us older ones to say, oh, maybe you'll do it next year, or you'll do it after uni. But it was their hopes and dreams. It's very easy for us to be dismissive, but they are living through that disappointment.
I think the universities have also subscribed to the narrative that 18 to 25-year-olds are completely fine. And, if we get it, we get probably a cough at most, but it's just not true.
The older generation have taken the worst hit physically in the pandemic. Awful. But emotionally and mentally, our youngest generation are the ones who have had and will have for the longest time in their life, in that they'll carry that weight and that burden forward. The impact of the pandemic has hit them hardest.